After passing CBT and IELTS on the third attempt, it took him 6 months to land his first interview. But guess what? He failed. You know that kind of email where it begins, "We regret to inform you that on this occasion you were not successful for the position," and da 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 da. This is very heartbreaking, but that is the sad experience of Alex. But the good news is, he has carried the cross, so you don't need to carry that cross again. That is why you are watching this video. So make sure you like it and stay to the end. We will look at how to answer nursing interview questions to the satisfaction of the hiring manager, following a structured approach with examples to help you prepare and practice for success in your upcoming interview. Nursing interviews often focus on assessing the candidate's clinical knowledge and competence, interpersonal skills, critical thinking abilities, relevant experience, behavior, attitude, and professionalism. Throughout the interview, questions in one way or the other assess these qualities. A typical interview has about 3 different phases, which I call ICC. This ICC stands for Introduction and Greetings, Candidate Assessment, and Closure. So we talk about the phase 1 of the interview, which is the Introduction and Greetings phase. In this phase of the interview, the hiring manager will normally welcome you to the interview, introduce themselves to you, and try to crack some jokes or what I call the icebreaker talk to calm your nerves and help you feel comfortable and relaxed. And then we have what we call the candidate introduction, where the hiring manager invites you to introduce yourself. This invitation can come in different forms, but be sure to highlight your background, your experience, and interest in the position. This candidate introduction section ends the introduction and greetings phase of the interview process and initiates you into the second phase of the interview, which is the candidate assessment. So most time, the candidate introduction question will come like, "Tell me about yourself." After answering this "tell me about yourself" question, they follow up with several questions which we'll cover in the phase 2. This phase assesses your competency for the role. You will encounter questions like behavioral and situational questions, technical or clinical skills assessment questions, and culture, faith, and values alignment questions. The behavioral and situational questions are designed to assess your past behavior or hypothetical scenarios related to nursing practice, patient care, teamwork, and problem solving. These questions may focus on your clinical knowledge, your communication skills, your critical thinking abilities, and professionalism. Then we have technical or clinical skills assessment, which is also part of the phase 2. Now, depending on the role you are applying for, the hiring manager may conduct a technical or clinical skills assessment to evaluate your competency in specific nursing procedures or practices. This may involve simulations or practical demonstrations like, what will you do when a resident has a fall, assuming you are interviewing for a care home nursing role. And then we have culture, faith, and values alignment questions, which is the final part of the phase 2. The essence of this question is to ascertain your alignment with the organization's values, mission, and culture. They may ask questions about your approach to patient-centered care, teamwork, diversity, and inclusion. This question will focus on the company's values and culture, and you can't mess up. So it is crucial to know about the organization you are interviewing for. Provide examples of how you align with their values and how you'll be able to work well with the company to help them achieve their goals and your goal. And then we have the final part of the interview process, which is the closure. This is the final phase of the interview. The hiring manager may invite you to ask questions about the position, the organization or their workplace culture. You have the opportunity to make any relevant clarifications regarding the position, such as professional growth and career advancement opportunities, and anything that will help you excel in the position but wasn't highlighted. At this part of the interview process, you will be provided with any additional information about the next steps in the hiring process. They may also ask you to provide any final comments that you may have. So basically, these are the three phases in an interview. We have the introduction and greeting phase, we have the candidate assessment phase, and we have the closure. And every interview typically will follow this process, even if not in a chronological order. Now let's zoom into how to answer interview questions following a structured approach. Most times, people fail interviews not because they don't know the answers, but the way they structure and present the answers. To answer necessary interview questions effectively and efficiently to the satisfaction of hiring managers, you need to consider these steps. I cannot overemphasize them. The first one is understand the question. Take a moment to fully understand the question being asked. If needed, ask for clarification to ensure you provide a relevant response. Point 2. Practice active listening. Pay attention to the interviewer's cues and body language and adjust your responses accordingly. Listen carefully to the question and respond thoughtfully rather than rushing to answer the question. Point 3. Structure your answer. Structuring your answer will help to communicate your idea in a one coherent and consistent sequence. Organize your response using a clear and concise structure, such as the STAR method, which is Situation, Task, Action, Result method for behavioral questions, and ADEE method, which stands for Acknowledge, Define, Explain, Example for technical questions. This structure will help you break down your response into key points or bullet points to ensure clarity and coherence. Provide specific examples. Support your answers with specific examples from your experience, such as clinical scenarios, patient interactions, or teamwork situations. Giving examples validates your skills and experiences. You realize that if you follow the structure like the one mentioned above, you would have emphasized your clinical competence, your critical thinking abilities, your communication skills and professionalism in a very clear and concise way. Another point is be honest and authentic. Be honest and genuine in your responses, avoiding exaggeration or embellishment. Share real-life examples and experiences that demonstrate your abilities and qualities authentically. These examples could be occurrences you witnessed, not necessarily concerning you. Cast your mind back to the world, reflect, and you'll get so many things to talk about. Stay concise and focused. Keep your answers concise and focused, avoiding unnecessary details. Aim to provide clear and direct responses that address the core of the question without rambling. Demonstrate confidence and enthusiasm. Speak confidently with enthusiasm about your experiences, your skills, and passion for the job. You can be providing the right answer, but without confidence, you will only sound like a loser. Maintain good eye contact, posture, and vocal tone to convey professionalism and engagement. Now let's look at how to use the STAR and the ADEE methods to answer questions in a structured manner. We will do this by using two different examples. So let's start with the STAR method. So like I said earlier on, the STAR is an acronym for Situation, Task, Action, and Result. The situation here is you stating the situation you find yourself in. And then the task is what you are required to do in that situation. Then actions are the actions you will take to solve whatever problem is in that situation, or what actions you are taking to achieve the task in that situation. And then after taking the actions, what results did you get? That is what the result stands for in the STAR method. So let's take an example question and see how we can use the STAR approach to answer that question. Can you provide an example of challenging patient care situation you have encountered and how you handled it? This question is asking you to give an experience from your practice where you face a challenging patient situation and how you handled it, what you did to solve the challenge. That is what this question is demanding from you. So by using the STAR approach, you first state the situation. If I were to be the one answering that question, I would say, while working in the medical surgical unit, I encountered a patient who was admitted with multiple comorbidities, including diabetes, hypertension, and chronic kidney disease. And that is the situation. So what is your task in this situation? My task was to provide comprehensive care to the patient, including medication management, wound care, and monitoring of vital signs. So what action did you take to achieve this task? So upon assessment, I discovered that this patient's blood glucose levels were consistently elevated and they were non-compliant with their insulin regimen. Additionally, the patient had stage 2 pressure ulcer on their sacrum that required meticulous wound care to prevent further deterioration. I initiated a conversation with the patient to understand their concerns and barriers to adherence. Through active listening and empathy, I learned that the patient had misconceptions about insulin administration and fears related to needle. I provided education tailored to the patient's needs, explaining the importance of insulin therapy in managing diabetes and addressing their concerns about pain and discomfort. I also collaborated with the healthcare team to adjust the insulin regimen and incorporate alternative methods such as insulin pens to improve adherence. For the pressure ulcer, I implemented a comprehensive wound care plan, including frequent repositioning, the use of pressure relieving devices, and the application of advanced wound dressings. I involved the patient in their care plan, teaching them about proper positioning techniques and the importance of offloading pressure. Throughout the process, I maintained open communication with the patient, addressing their questions and concerns, and reassured them of our commitment to their well-being. And this is the result I achieved from these actions. As a result of our collaborative effort, the patient's blood glucose levels gradually stabilized within the target range, and they became more compliant with their insulin therapy. The pressure ulcer showed signs of healing, with decreased wound size and improved tissue viability. The patient expressed gratitude for the personalized care they received and reported feeling more empowered and motivated to manage their health effectively. This experience reinforced the importance of patient education, effective communication, and a holistic approach to care and achieving positive outcomes for patients with complex healthcare needs. So you realize that by using the STAR method, you can provide a structured and comprehensive answer that highlights your skills, actions, and the positive outcomes of your interventions in a clear and organized manner. I said a lot in this answer, but you don't need to give that much details. You can make it in a simpler way. The most important thing is you are giving relevant answers. Let's look at a second example where we'll use the ADEE method to answer the question. The ADEE method is good for answering technical questions that involves explanation of terms, technical nursing terms or nursing practices, like when you are asked to explain what you understand by safeguarding, explain what you understand by confidentiality, and all those things. the ADE method will work best for this kind of questions. So like we know, the ADEE method stands for acknowledge, define, explain, and example. So with the ADDE method, when they ask you the questions, you first have to acknowledge the importance or the relevance of that question. And then define. You give a definition in simple terms or per your understanding to the term you are being asked. If you have further explanations that could help communicate your understanding very more clearly and even in simple terms, then you explain. After acknowledging, defining, and explaining, you give an example to validate your skills, your point, or your knowledge. And this helps you to present your answer in a very organized and concise manner. So let's look at an example. An example question is, can you explain the concept of sepsis and its clinical manifestations? So this is how I will answer this question, or I will approach this question using the ADEE method. First, acknowledge. Understanding sepsis is crucial in nursing practice, as it is a life-threatening condition that requires prompt recognition and intervention to improve patient outcomes. What is sepsis? Now we are defining sepsis, so define. Sepsis is a systemic inflammatory response syndrome triggered by the body's overwhelming response to an infection. It occurs when the body's immune system releases chemicals in response to a disease process. This can cause a widespread inflammation and even organ dysfunction. In sepsis, the body's response to infection can lead to a cascade of harmful effects, including vasodilation, increased vascular permeability, and impaired tissue perfusion. This can result in hypotension, tissue hypoxia, and organ failure if left untreated. Sepsis can progress rapidly to severe sepsis or even septic shock, where there is profound hypotension and inadequate tissue perfusion. After explaining, we move to example. So this is an example I will give. Few months ago, a patient was admitted to my ward with pneumonia. Suddenly, she started experiencing fever, tachycardia, altered mental status, hypotension, and oliguria. Prompt recognition of these signs and symptoms was essential in establishing that she had developed sepsis. Timely interventions such as antibiotic therapy and fluid resuscitation were initiated to prevent further deterioration, and that saved my patient's life. So you see, by following the ADEE method, you can provide a structured and comprehensive answer to technical questions, ensuring that you address the key components of the question and demonstrate your understanding effectively. So use these two examples to prepare and practice for your interview. Go and look for different nursing or common nursing interview questions and practice with these examples I have given you. If you don't understand anything, repeat the video and do further research to get more understanding. Review common nursing interview questions and practice your responses beforehand. Consider conducting mock interviews with friends, a family member, a mentor, and receive feedback to improve your interview performance. I hope this video gives you confidence about your upcoming interview. If you are not subscribed yet, then subscribe to my channel and look forward to my upcoming video on common nursing interview questions. Congratulations on passing your interview, and don't forget to share this video with a friend.